Hi everyone, Nathan here from Personal Best Physiotherapy in Wodonga. In this video I'm going to show you how to do shoulder extension, an exercise that is very useful for shoulder pain. We use this exercise a lot when patients have shoulder bursitis and they have pain both to lift their arm up in front of them or to lift their arm up overhead, and also if they have pain with hand behind back. So when we see those two things together, pain in both of those movements, this is an exercise which we will test in the clinic to see if it has a positive effect on your pain and movement. I'm going to show you 3 variations of shoulder extension. They start off being easy or low intensity, and then we move up to moderate intensity, and then we finish with the third one, which is a higher intensity movement or stretch. Let's get straight into it. So extension is moving the arm behind the plane of the body. So if we're talking about the shoulder, we want to move the arm this way. And when we first start doing this, we ask the patient to have their thumb facing forward, their pinky finger facing backward, and also their opposite foot forward. So if I have a problem with my right arm, I will step my left foot forward. This basically keeps me upright. And we want to be moving the arm like this. Thumb facing forward, pinky finger facing backward. When patients do this, they typically find that they don't have a lot of pain, but they'll feel a stretch or tightness, or maybe a soreness in the shoulder, but it's usually very tolerable. So we're stretching the arm behind the body, like so, just in a nice, steady fashion. And we would often get the patient to do about 10 repeats and then reassess to see if it's been useful for them. The second exercise is often, if that has worked initially, after a few days, then we need to put a little bit more into it. A little bit more force or a little bit more stretch. And the way that we can do that is with a stick. And so we put the stick into the palm of the hand, and now we use the other arm, so your non-affected arm, to push that just a little bit further. Notice how I've got my opposite foot forward, so I feel stable and upright, and I'm using my left arm to just put a little bit more pressure or a little bit more force into that stretch. Same thing, we'll often ask the patient to do 8 or 10 repeats and then reassess some of their other movements. So that's the second variation. And then the final variation is where we do the exact same thing, but we hold on to either a post or perhaps the door frame. So we anchor the hand onto the door frame, same position with the opposite foot forward, but this time we're sort of putting some more input or some more force into that stretch, so it becomes stronger. So we're lunging forward, getting some more stretch into that arm, maybe reaching up the door frame a little bit, leaning into it, and getting more stretch into that direction. We usually don't start with that third one. That would be a progression after the patient has done the first 1 or 2 exercises. So that's shoulder extension. When we get this right, as in it's the right exercise for you, patients often report significant improvement over a short period of time, 3 or 4 days. And what we're looking at is those patients say that they have less pain at night, they have less pain at rest, and they're able to start moving their arm, maybe not 100%, but certainly better than when they started. If you have any comments, put them below, and talk to you soon.